Here we go. And welcome everybody to the Health Transformation webinar. This is your host, Cade Archibald, and I'm really excited to be here with you guys today. Along with me, as usual, we got the amazing original founder of East West Health, just a amazing author, and just all around, he's a fairly decent guy. No, he's a great guy. So we got Regan Archibald with us. Regan, how you doing?
Really good. Really good. Except I forgot my blue light blocking glasses. So
oh no,
brain's gonna get fried today.
Brain is getting some EMFs. I got my EMF shield, the laptop case.
Oh great. Yeah, those are awesome.
It's like a shield, so it's blocking all the blue light, right? Not really.
Yeah.
That's what I tell myself at least. So welcome everybody to the webinar. Today we got some really cool stuff we're going to be going over on SIBO and digestive health. We'll be talking about some different patient case studies. You may have some of these symptoms, or you may know someone that has some of these symptoms with SIBO and different digestive health problems. And so this is really insightful stuff to learn, understand, and we're going to be going over some different solutions and case studies. So if you need help with this, reach out to us at one of our East West Health locations. Regan, let's dive in. I love the elemental diet for SIBO is super effective. So it looks like that's what we're going to start with.
Yeah. So 2 weeks ago we did SIBO part 1. This is SIBO part 2. And this one it's really interesting because if you do have SIBO, and we're going to talk about case studies today, but there's treatments that exist out there. One of those treatments is a diet. It's called the elemental diet. And so we use the dextrose-free because the elemental diet from Integrated Therapeutics, there can be too much sugar in it. And last thing we want you to do is get your blood sugar dysregulated when you're on this process. But this is a 14-day, it's a powder liquid diet. And it's an interesting process that I've seen my wife go through recently, and it's completely transformed the way that her guts felt. She's had years of issues, and we've thrown all the Chinese herbs we can at it. We've put her on a restrictive diet. She's very disciplined, so it's not like it's an issue with the patient compliance. But it's actually the only thing that's been able to push her consistently to feel better with no stomach pain is the elemental diet. And she's been off it for about a week now and still feels great. And I just expect her health to just continually improve. So this SIBO is a beast. When you get that infection in your small intestine, it's not an easy one to pull out. So what the elemental diet looks like is it's basically a powder, and it's got all your essential ingredients in it that are low FODMAP. So these ingredients are not going to feed the infection, either a yeast or a fungus infection. And it's very simple because when we do the breath test, you're going to see as we go through these case studies that people's, some of their hydrogen levels are elevated or their methane levels. And in the past, we would have to get very selective and give you either a methane-based, supplement regimen and specific diet, or a hydrogen-based supplement and diet regimen. But now what we're discovering is actually with the elemental diet, you can cover both of those. And you don't want to be on a lot of supplements there. Phytosan or yeastinal, these are okay to take if you've got, just to keep your minerals up is what Phytosan will do. The yeastinal is if you've got the fungus overgrowth. You can look at your fingernails right now, and if you see little dots on your fingernails, Kate, do you have any dots on your fingernails, those white dots? So probably no yeast for Cade, which is great. He's looking a little closer.
I have one.
So like maybe a little bit.
I think that's from a puncture.
Okay, so if it's from a puncture, probably not going to be yeast, but yeah, you can look at your toenails. If you got fungus growing on them, there you've definitely got some in your gut. So let's talk about some case studies, because I think, yes, there's a process we can take you through, and I don't want to get too into the weeds on exactly what we do about SIBO, because It is a case-by-case basis. It's not like, okay, everyone who tests positive for SIBO, here's what we do. We have to get your body prepped. We have to make sure your hormones are regulated, your neurotransmitters are regulated. You just got to make sure we've got the right lifestyle in place as well. And so let's talk about some case studies with SIBO. So with SIBO, here's Amy. She's a 55-year-old female. She's complaining of GI issues. Hospitalized 2 summers ago for pain in her upper abdomen. She had scopes and endoscopy, colonoscopy, gallbladder test, celiac test, everything that you would expect a GI doctor to do. She had these tests, and all the results came back negative. Pain resolved within a week, and she was fine. So she had all these intense pain that put her in the emergency room, and then the pain resolved. And so she watches her diet now, but she'll bloat after she eats. She no longer can wear jeans because it was putting pressure on her stomach. Her joints started to ache, and she didn't have any more of these acute flare-ups, but she just noticed she had this general overall bloating, pain, and so she was diagnosed with some type of acid reflux. So she was put on omeprazole, and she was put on an over-the-counter probiotic for gas relief. And what she also noticed is she had abdominal intolerance to sugars and starches and excessive belching. And so she had indigestion, fullness 2 to 4 hours after eating. And a lot of these symptoms, what we would look at clinically, we'd say, well, this looks like it's a classic case of gallbladder dysregulation and not getting enough bile to digest foods, stomach acid dysregulation. But as we dove deeper, we said, well, let's test. And so we ran a stool test on her. And what we found is she had an infection of blastocystis hominis. Now, Cade, that sounds kind of like a spider version, but it's actually a parasite. So do you know anything about the blastocystis hominis?
I don't know. I don't know anything about it. It sounds scary. Like if I heard that was crawling around in my gut, I would be like a little concerned.
You'd want to blast it right out of there.
Yes.
Cystis hominis. And so that is exactly what we did. We said we've got to get rid of this parasite that's there. And then we also found that there's an insufficiency of fecal fat. So that means there's poor digestion of the fecal fats. And so remember, if we look at her symptoms, she's getting a lot of bloating. She burps a lot. That is a classic sign of a gallbladder imbalance. And so she's probably not making enough bile. And then when we ran her stool test, we confirmed it. And so remember, it's about testing and not guessing when it comes to your health. We found that she had an imbalance in the beneficial bacteria was very low. The pathogenic bacteria was very high. So even though all the tests she ran, everything looked normal. Everything, nothing tested positive. Everything was negative. That is a negative experience for a person who is having insane digestive issues. And so one of the things that we did is we said, well, all right, let's get the blastocystis hominis. Let's get that taken care of. Let's get you on some bile salts so you can start emulsifying some of the fats you're eating. And you've already been working on colonizing the good bacteria, but let's do that. And then we're going to test you for SIBO. And sure enough, when we tested her for SIBO, as you can see, her hydrogen and methane tests, she tested positive on the methane gas. So hydrogen, she was 0, so that's good. But the methane, she was 25 parts per million in the breath test. And so we realized, okay, you've actually got SIBO, and that goes along very, very well with anyone who's got blastocystis hominis. So once again, if you get the right test, then you can know the treatment strategy. We put her on the elemental diet, the one I explained to you earlier, and she stayed on that for 14 days. And then we retested. We did the breath test again. And what we found is not only is she feeling better, which we'll talk about in a second, but the objective findings showed that her methane went from a 25 to a 4. And anything below 10 parts per million is considered within normal limits. And so, Cade, how do you think her overall body felt after she got rid of the infections and the SIBO?
I felt significantly better.
Yep, and that's
less joint aches, less digestive discomfort, brain fog is lifted. Yeah, there's so many different symptoms that if you have some of these infections, you're going to be it could manifest in a lot of different ways.
Exactly. And so what she noticed right out of the gates is her energy popped up, all the belching, the bloating went down. She could put back on her workout pants because she would look like she was pregnant when she would get bloated out. And she's actually, pretty fit lady. And so that was very interesting. So let's move on to Cindy. So Cindy is a 56-year-old female. Her main complaints are fibromyalgia, brain fog, chronic pain, and adrenal fatigue. And Cindy is someone who has visited all the natural clinics. She's worked on adrenal protocols. She's worked on fibromyalgia protocols. She's done everything, even to the extreme of stimulants for the brain fog and chronic pain. But as Nicole Dreyer, and Devin Thomas, who put these case studies together, as they investigated further, what they revealed was there's lower abdominal pain that was relieved by passing gas or stool. Sometimes she would have more than 3 bowel movements a day that were hard and dry. And so she had weight gain, difficulty losing weight, high level of stress, which typically goes along with adrenal fatigue and fibromyalgia. It's funny because when you're really tired, your stress levels go up very high because life is going to throw some curveballs at you. And so there's that interesting correlation, high level of stress, low level of energy. She was sleeping poor, just wasn't feeling good. So right out of the gates with anyone who comes in, we got to get the right tests ordered. So we had Cindy's initial comprehensive stool profile ran. And what we found is no infections, no pathogenic issues. Her inflammatory markers look pretty good in her intestines. But we found she had a high amount of total protein products in her stool and a high amount of fecal fats. And so once again, was an issue where she was not digesting the food she was eating. And so you look at that, and as you eat your food, a lot of the protein breakdowns the proteins get denatured in the stomach. And so what we realized is, okay, we've got to get your digestive system functioning again. This is where a lot of the symptoms were coming from, and fatigue. And then we also found that she had a high increase of pathogenic bacteria. Her beta-glucuronidase was very high, which can lead to autoimmunity and systemic issues. And that's actually pretty common to see the beta-glucuronidase elevation in anybody who's got fibromyalgia. And then her beneficial bacteria was very low. So even though she didn't have any infections, she had an environment in her gut where she didn't have the abundance necessary to really keep her healthy. And so this triggered the idea that, man, we better test her for some type of internal infection. And we said, it's time to test her for SIBO. And so we got, after doing a little initial work on her digestive system, getting her to digest her foods better, getting her on some digestive enzymes, making sure that she's chewing her food, she's not eating when she's stressed, lifestyle things were very important. Then we said, all right, we're going to get your SIBO breath test. And with her SIBO breath test, what was shocking is even though in her gut, in the stool test, it showed nothing. It tested negative for any type of pathogenic invasions. When we looked at her small intestine, because small intestine, this is when those pathogenic bacteria can migrate up into the small intestine from the large intestine and populate that area and infect it. But what we found is when we looked at her hydrogen levels, she had a 77, and you want to be lower than 20 parts per million. So she tested very high in hydrogen. And then even on her methane, she tested 9 parts per million. So she was right on the border. And so we said, okay, it's time to do the elemental diet. And so Cindy, we put her on the elemental diet. And the first 3-4 days, she was in a lot of detox reaction. She didn't feel good. And so a lot of you, when you come and you decide, all right, I really got to get my gut fixed. I want to have better energy. I want to have my joint pain gone. I just want to feel more vital. Well, it's that first 3 days that's difficult. It's a challenge. And so as she went through that, the biggest breakthrough that she had is she started, once she got through that initial detox, she started feeling better and things started to bounce up. And she started noticing like, man, I'm sleeping so much better. I mean, that was the very first change. Her abdominal pain went away, the upper right quadrant. And then we said, all right, let's retest your SIBO again. And what we found as we retested Cindy is her hydrogen levels went down from a 77. They dropped all the way to a 16, which was phenomenal. Her methane even went down to a 4. So then it was in the safety zone. It wasn't up there right on the borderline. So that's Cindy with the elemental diet, and very, very powerful there. But Cade, what, if you imagine Cindy's life, if we didn't look in and discover she had SIBO, where would Cindy be right now?
It probably either staying the same as far as her health goes, continuing to have more and more symptoms, and eventually the problem with just letting SIBO go is your symptoms will become worse and worse. Could turn into more autoimmune type cases where you have could lead to thyroid issues, could lead to skin problems, psoriasis, a lot of different things down the road. But yeah, like just, life in general is a lot less enjoyable when you're dealing with a lot of those symptoms.
Much less. And I look at Cindy and even Amy, the patient that we talked about before, and I say, man, if we didn't get to the underlying cause, we just had a patient named Olive, and she's written a testimonial about her experience here, but we were able to find out that she had this parathyroid tumor, and that's why nothing was working for years. She felt so crappy. Her osteoporosis was out of control. Her arthritis was out of control. But because of the labs we ran, we were able to uncover what was really going on. And it just, what she said is East West saved my life. And so it's so critical that you get the right test order so you can actually see what's going on. So let's talk about Daphne. And she's a 55-year-old patient. She had joint pain in her right elbow, both wrists, both knees. She's also experiencing brain fog and bloating after meals. Low appetite for about 10 years, doesn't eat very much. She snacks a lot. It's like everything she eats just goes boom. It just causes her to balloon. So when you're bloated, you don't really feel like eating a big meal. So she would just graze. She did that for 10 years. She had breakfast grains, berries, and chia seeds. She also, for lunch, she'd have a salad with sweet potatoes, avocado, pepper. Dinner, she'd graze on fruits and nuts. She drinks about a half a gallon of water per day. She feels thirsty all the time. She's had a hysterectomy, one ovary left. And so we looked at this, we said, how can we help Daphne just like really regain her life, regain her health, get rid of this pain, and really how can we get her on a consistent eating schedule? So the very first thing we did is we ran a stool profile, and we did it through Metagenics. And what we found is not Metagenics, Genova, excuse me. What we found is that her fecal secretory IgA was elevated, and that was one of those inflammatory markers. She didn't have any infections necessarily, which is a good thing. But with the fecal secretory IgA, we realized, okay, there is something that's irritating the lining of her gut. And, because nothing showed up on the infection, we didn't just leave it at that and say, oh, there's nothing wrong with the gut, because we also saw that she had a decrease of total short chain fatty acids. Now, short chain fatty acids, those are the foods that your bacteria love. So when we tell you to drink some MCT oil in your coffee, or use more coconut, it's got these short chain fatty acids and medium chain fatty acids that your bacteria just love to munch on. That's like one of the best foods for them. And so, we saw that there was a general insufficiency in her overall abundance, but nothing startling. So what we said is, well, let's run the SIBO test. And that's where, Nicole Dreyer is just a wizard at this. She just said she can sniff it out from a mile away. And sure enough, after we tested Daphne's initial SIBO test, because remember, the bacteria in the small intestine, they can hide. And they can, the off gases and the biotoxins from these infections, it's just like having a parasite in there that's just eating all your nutrients. And so you're going, man, why do I feel tired all the time? Why are my joints achy? I'm not as flexible as I used to be. I'm higher stress, and there's not more going on in my life. Why is this going on? And with Daphne, just like with Amy and with Cindy, we discovered that sure enough, her hydrogen levels were high. She tested positive for SIBO with 26 being her total parts per million, and then her methane was 4. So methane was within normal limits, but her hydrogen levels were elevated. So we took her through and we decided, let's do the elemental diet. And we took her through the elemental diet. So this is that 14-day powder and liquid diet. And the interesting thing about her is she had a change in her overall methane. Her hydrogen levels dropped, but her methane levels actually were elevated. And we looked at this and we said, oh, that's very odd. But what you'll see in certain cases, because Daphne had had this condition for over 10 years, the bloating, eating the way that she had, it was like with the elemental diet, we were able to get rid of one of those infections, but then that methane infection was able to creep up. And so we're actually working on getting that methane levels down now. But very interesting, because this is rare that you'd see that. But that's where when we see that you've got inflammation in your intestines, there's going to be a whole host of problems that aren't manifesting, because what bacteria can do is they can hide under what's called biofilms. And biofilms is like if you ever run your tongue across your teeth when you haven't brushed your teeth, like if you've been traveling, for 12 hours and your teeth get kind of that slimy feeling, that is a biofilm from the bacteria on your teeth. And that's where I have to warn Cade and remind him to brush his teeth on a regular basis. So did you remember this morning?
Maybe.
Are your teeth slimy? I mean,
they're a little slimy. I don't know.
Moss.
I need to go back and rewind the morning. No,
yes,
they're nice and shiny clean.
Oh, good. Yeah. So I think it's really, it's interesting. So Cade, this is an unusual case where you'll actually see that there's these bacteria species that can crawl out of the biofilm. When they start to get starved out, that's when they can crawl out. So if that those methane producing bacteria were actually not under that biofilm, we would have seen it much higher in that initial test that we did with Daphne. So very interesting. Okay, let's move on to Jenny. She's a 66-year-old female. She's been to 2 GI specialists, and no one knows what's going on. It's basically IBS, and as you learned in that first the first SIBO presentation that we did, IBS sufferers that were tested, there's 80% of them actually tested positive for SIBO. So this is not something many specialists are testing. However, more GI specialists are actually getting on the bandwagon, realizing, okay, SIBO is a real thing. But what she found is that she had severe gas, bloating, frequent bowel movements, very soft, diarrhea, and slight depression. She just didn't feel good. So we ran her gut test, and very first thing we found is EPX. So this relates to the eosinophils in your gut, and we found that it was elevated. She had high levels of inflammation. And when you have high levels of inflammation in your gut, it really puts us on high alert, because that's going to trigger downstream other autoimmunity, and it's going to cause your body to age much quicker. We found that her fecal fats total was elevated, so she was not digesting her fats. She had poor bile secretions from her gallbladder, and then what was also happening is she wasn't digesting the fats because she didn't have a healthy population of certain bacteria. We found that her total short chain fatty acids was low, and her butyric acid was low. So butyric acid, and Cade, you may know this, but the best way to get your butyric acid is from butter. And so Cade, what do you love about butter?
I love putting butter on my vegetables and in my coffee.
Yeah, great place to use it. But we found that, man, she's got to get those fatty acids, because that's actually what your bacteria feed on. We always think of bacteria only eating like vegetables and fibers from grains, but actually if you have healthy meat, those short chain fatty acids are also found in healthy meat. So get yourself some liver today, everybody, and enjoy that. So with Jenny, we said, okay, we know that there's an issue here. We're seeing some imbalances in certain areas that would alert us to you having SIBO. And so what we did is we ran her SIBO test, and sure enough, what was uncovered is that she did have high levels of methane. And so we said, okay, it's not off the charts high, but it's high enough where it's like, okay, we can do this the easy way or the hard way. And she chose the easy way. And so we actually treated her with Xifaxan. And Xifaxan is a specific antibiotic. It is an antibiotic that's used a lot in IBS treatments. but it's also been shown to be effective if you've got very low levels of SIBO, which is what Jenny had when we tested her. And so she didn't have to go through the grueling 14-day process, but she did have to follow the diet. She had to get on that low FODMAP diet. And what we found is, just within a few weeks, we took her SIBO, and where her methane was elevated, we got it within normal limits just with the Xifaxan. And once again, it's not our ideal way to treat it, but if it's a low level, very easy, because the 14-day liquid diet is not always awesome. And so finally, for you men out there, you're saying, well, Regan, are you going to talk about any men? It's all been women. And so this is Bob. He's a 34-year-old male. His concerns are knee pain, hip pain. He'd also like to lose some weight. But the thing that triggered kind of the objective findings that we found is he has this lower right abdominal pain. And he's had his appendix removed. But that's where we kind of say, that's a commonplace for infections to develop, not necessarily SIBO, but infections in your large intestine. He had incomplete bowel movements and abdominal pain was relieved by passing gas. He uses a lot of laxatives, which is another red flag for us, and then frequent bloating after meals. So if you get bloated after meals, if you always feel really full, it's not normal. A lot of people think, I ate too fast, I ate too much. Maybe that's it, but it should go away pretty quickly. But if it's happening meal after meal, you probably got some SIBO. So very first thing we did with Bob, ran his stool profile. We found that his fecal secretory IgA was elevated. And once again, that's that inflammatory marker that gives us a big concern for autoimmune conditions. We found that he had an imbalance. Once again, he needed more butter. His butyric acid was low, his butyrate, his total short-chain fatty acids were low too. And so these were big red flags, and that's where it triggered us to say, well, let's see if you've got SIBO. Let's really dive in and see what's going on. And sure enough, when his results came back, he tested positive for both gases, for both hydrogen and methane. So his hydrogen came in high as well as his methane did. And so we put him on once again, his was 1 point over on both of those. So we put him on the Xifaxan and was able to get rid of his SIBO entirely. So some of the obstacles you guys are going to face when doing this is, how elevated is your SIBO? There is the kind of the short term and then the long term thinking around it. The long term is the elemental diet. The short term is, well, maybe there's a medication we can use. We're big fans of the long term, but once again, it depends on where you are. It depends on how severe things are, but we've been able to help people overcome their toughest health challenges just by this simple protocol of testing to see if you have SIBO. So appreciate everyone being on this. And Cade, any final questions or comments before we close out?
No, I think got some great feedback from some of our attendees. Just really good information. Hopefully you guys learned some really cool things on how you don't have to live with digestive health problems if you know someone with IBS or maybe you suffer with that. There's so many better options out there rather than just some of the medications that people are taking, some immunosuppressants. There's a lot better options out there, and I think these case studies were amazing. Thank you so much for sharing today, Regan. If you know anyone with digestive health problems looking to get some help, maybe that's you, maybe that's a friend, have them reach out to one of our offices. Go to East West Health. That's acueastwest.com. Love you guys so much. Thanks for tuning in today, and we'll look forward to seeing you same time, same place next week. Bye-bye, everybody.
Bye-bye.